A warm welcome to today's webinar on planetary health and sustainable physiotherapy education. Today, we would like to explore together how sustainability can be more strongly integrated into teaching, academic education, and clinical training, what role physiotherapy can play in a rapidly changing world. We will take a closer look at innovative approaches and projects from local, national, and international contexts, particularly across Europe. You can look forward to inspiring insights into modern educational concepts, such as a case-based learning and interprofessional education approaches that aim to teach sustainability in practical and clinical relevant ways. At the same time, this webinar offers space for reflection and how we can further develop our own teaching and learning practice in a responsibility and future-oriented manner. Through concrete examples and diverse perspectives, we would like to discuss which strategies and collaboration are needed to help shape a more sustainable future for physiotherapy. Before we begin, I would like to introduce our speakers. Elena Fluch, Master of Science, is a full-time lecturer in the physiotherapy degree program. She completed her master's degree in neuroorthopedics and disability management at the Donau University Krems. In her teaching, she integrates topics such as planetary health and ecological sustainability. In addition, she works in her own private practice. For more information, please see the chat. Professor Robert Richter's main areas of focus are active mobility, planetary health, and the integration of sustainability aspects into education and continuing professional development. Robert Richter is a physiotherapist, medical educator, and professor of exercise therapy at the Furtwangen University. His work focuses on the interconnections between active mobility, planetary health, and sustainable healthcare. In addition, he is committed to the academization and further development of the health profession, as well as to interprofessional and transformative approaches in physiotherapy. So for more information, please see the chat. Filip Maric is an associate professor in physiotherapy, healthcare, innovation, and sustainability at UiT, the Arctic University of Norway, and founder and executive chair of the Environmental Physiotherapy Association. His work is focused on planetary health, sustainability, and environmental physiotherapy, including the corresponding transformation of physiotherapy theory, education, and practice. Rena Patel from the United Kingdom, she works at the member organization and took responsibility for coordinating and management the chat. Over the past 2 years, we have had the pleasure of working together with the Education and Research Working Group. And now we start the first speaker, Elena.
So, good evening from the Carinthia University of Applied Sciences in Austria. Thank you for the introduction and thank you for the opportunity to share our experiences with you. I've seen you come from different countries from all over Europe and even more than Europe, from Brasilia, Philippines, and somewhere and Kenya I've seen. So good evening to you all. And I'm happy to share our experiences in planetary health education, or as I prefer to call it, in environmental physiotherapy with you. Okay, over the next 10 minutes, I will give you an insight into our way of integrating environmental physiotherapy, about the key contents we identified, and the choice of physiotherapy subjects with links to planetary health, followed by some concrete example from our lectures. 3 years ago, in 2023, we took the initiative to proactively integrate climate and health topics into our ongoing curriculum. We were a team of 3 committed lecturers, and we began with 1 to 3 units of 45 minutes as a starting point. Our first cohort of students has now completed 15 units, which is about 1 ECTS credit in planetary health education as part of their 3-year bachelor's degree program. In September, we will implement our updated curriculum. Since 2024, climate literacy has been legally mandated for all therapeutic and diagnostic health professionals in Austria. Our program will include 2 courses, one in the first and one in the 6th semester. They will build upon physiotherapy profession and ethics, and in the 6th semester on public health. Each course will have 8 units of 45 minutes, which is 16 units or 1 ECTS credit within the whole program. During my research on sustainability education, I gathered a wide range of teaching materials, and I developed 5 key thematic areas to structure the content. You can see them on this slide. Actually, before I start with the main contents, I always give the students some positive examples, some resources and inspiring initiatives. For instance, I show the homepage of the Environmental Physiotherapy Association. You will hear a lot of this later. Or I highlight green hospitals or reforestation projects. And even talking about this webinar to my students can be used as a positive resource. So now I will give you an overview of the main contents. The first topic is basic knowledge. It covers the direct and indirect impacts of climate change on human health, and also the source of greenhouse gases from different sectors and countries. Other topics can be planetary boundaries or the Earth's overshoot day, or there are a lot of more topics we can talk about in this first topic. The second one is heat protection measures. I know it's very hot today, and global heat waves increase. Physiotherapists must protect vulnerable patients, such as the elderly or those with chronic illnesses, from heat-related risks. At the same time, they have to manage their own work in overheated environments. Heat stroke is a medical emergency, and physios must be able to recognize signs of overheating and respond quickly with first aid. The third main topic is creating awareness and being a multiplier. For me, this is a crucial topic. We discuss how to engage in climate-sensitive communication and explore transformative actions that can be implemented at the micro, meso, and macro level. The fourth topic focuses on sustainability in our professional environment. The healthcare sector is responsible for approximately 5% of global greenhouse gas emissions. We explore initiatives such as green hospitals and green teams, as well as discuss actions, whether in a team, in a small clinic, or at a large hospital setting. The fifth point is health promotion. That is climate protection. This highlights the co-benefits, a win-win situation for both our health and the environment. For example, active transport, such as walking, cycling, or using public transit, even for just 10 minutes a day, improves personal health while reducing fine dust pollution and cutting emissions. A plant-rich diet is the other co-benefit, and it serves both purposes as well. Depending on how much time I can use in my course, I can either present all 5 topics, or sometimes I dive deeper into one of them. The next section focuses on physiotherapeutic subjects which can easily be linked to planetary health education. And there are so many possibilities. My own journey began with physiotherapy for groups. I taught Nordic walking techniques, and during our walks back, I encouraged students to observe and reflect on their natural surroundings. This approach led me to explain the co-benefits of active transport. During the lecture on posture and gait analysis, I did it also today, we explored different footprints from a flat foot or a valgus deformity, as you know well. This inspired me to assign a group task, researching and explaining the ecological footprint and also the German watch handprint, which describes our positive impact on the environment and climate. In the scientific work course, my colleague explained various study types, statistics and tables. Among these, she used examples that focus on the relationship between environmental factors and health. For example, the impact of heat waves on multiple sclerosis. The role of a plant-rich diet on inflammation and on wound healing was a part in the physiology lecture. The lecturer also addressed the land use for meat production in comparison to the plant-based nutrition land use. Other examples are professional communication, internal medicine, pediatrics, neurology, or mental health, even health promotion or public health. In all these fields, patients are at high risk from rising temperatures. This is a chance to address heat protection measures or other topics like increasing respiratory diseases caused by air pollution, and even more, the air pollution is caused from wildfires. Now I give you some examples from last year. The Heat Action Day is a nationwide campaign in Austria. It's held every June, and I think also in Germany. Last year we took part with a video competition. Our physiotherapy students created short videos showcasing heat protection measures, such as tips for waiting rooms in clinics or lecture halls at the university. The best video was chosen through a public vote. I'll show you one of the videos. It's called Don't Be Like Tom, Listen to Hannah, and it has no dialogue. And I will start. In the end, there are tips for cooling and the number of the heat emergency call. And of course, the tip, listen to Hannah. I hope you've gained some inspirations for planetary health education. Here are some useful links that I use a lot. It's easy to integrate environmental physiotherapy and to get started with. Thank you very much.
Thank you too for the European region of World Physiotherapy for setting this topic, and it's an honor for me to address this topic in this webinar. And I will talk to you how to implement planetary health in curriculum and lessons in physiotherapy education. I will start with a very well-known aspect. I think the ICF is one of the main topics for structuring and the education in physiotherapy around the world. I think we all know the ICF, and so we have a common instrument for teaching and talking about environmental and sustainable factors in relation to health. We have a lot of influences of environmental factors on prevention, treatment, and rehabilitation of illnesses, as well as the influence of environment in the sense of the ICF on health. And we have the influence of the natural environment on well-being and health. Finally, we have two pathways to handle with climate change and environmental pollution. First, we can adapt in a sense of a climate change resilient health system. And second, we can mitigate, what means we can do something to slow down the climate and environmental changes. And the ICF give us with the environmental factors a big point to address the topic natural environment and human-made changes to environment. And if you think about an evidence-based teaching, not only about an evidence-based practice, so for an evidence-based practice, we need an evidence-based teaching in our studies, and it's oriented on the ICF environmental factors. But to do so, it is important to get some expertise in the field of planetary health. And for a common expertise in implementation of planetary health in education and further education, it is necessary that we have some ideas what is planetary health and what is the content of planetary health in our studies of physiotherapy. What I will say is planetary health is so important, like for example, anatomy or pathophysiology for the understanding of health conditions. According to the WHO climate change is the biggest threat for health in the 21st century. And with the ICF, we have a good way to implement planetary health in our studies. So in the following, I will focus on professional education, not on patient education. And in my point of view, there are three common possibilities for implementing planetary health in professional education and curricula. The first one, how you can see on the slide, are elective courses. The second one are obligatory courses, and the third are existing courses to implement planetary health aspects in existing courses. All these three types of implementation have advantages and disadvantages, how you can see actually on the slide. And in our studies at Furtwangen University, we realize all of these possibilities in a different manner. But for me, the implementation in existing courses is the best way for coming to a practice performance in healthcare. So the integration of planetary health aspects in our courses we have in our classes and studies, it's a very short and easy way to reach all students and to do it in a low threshold level. I will give you an example for the implementation of planetary health in existing courses. Here you see the concept of 2 slides for future. The advantage is that this access is also low threshold for teachers. In this sense, the entry level for both teachers and learners is low, and inexperienced teachers can approach the topic in an accessible way and gradually deepen their understanding step by step. The concept is really simple. The original concept of 2 slides for future is to start every lesson with 2 slides for future, but I changed it a little bit. The 2 slides have not to be at the beginning of a lesson. The 2 slides can be during the lesson in any part of it. The concept is based on the assumption that the theme planetary health is connected to all content in healthcare education. So all teachers are requested to implement planetary health. How I taught you before, it is evident that we have some influences of planetary health in every part of physiotherapy studies. We, as teachers, are role models for a healthy life, and this includes healthy natural and environmental factors. We are also role models for our students, and the concept lives from cooperation and solidarity, means that the 2 slides for future activists share his or her content with all the others. So now I will give you some inspirations how to implement planetary health in existing contents in physiotherapy studies. The first example, we know a lot about the impact of medications on the in the life cycle of a drug on environment. Production, packaging, transport, and excretion have a great impact on the natural environment as well as on the human body due to side effects. This we can mention, and we can show that physiotherapy can reduce these effects if we talk in lessons about, for example, pain neuroscience education. The second example, surgery has, due to the needed energy, a lot of one-way stuff, medications, and so on, a big environmental impact. Reduce operations means reduce the impact on the environment, and physiotherapy is often a possibility to avoid operations. Here, for example, in the context of tendopathy. The third example, it's about heat periods like we have actually in Germany. Here I'm actually in Berlin. We have more than 30 degrees. And for all you people around the world, that is not normal in the end of the May that we have more than 30 degrees over more than one day. High temperatures increase injuries, especially for outdoor workers, and thereby increases the number of physiotherapy patients, in addition to the mentioned effects on the slide. This could take part in a lesson about occupational medicine or traumatology. The next example is about vulnerable groups. Sorry, the slide is partly in German. The left side of the slide counts the vulnerable groups, and if you can understand or you could understand, you can see most people are affected by climate and environmental changes. And on the right-hand side, you can see the diversity wheel. And that's a good part to address inequality around the world, especially for the global south, in the context of planetary health. And the next example I give to you, Elena talked about it, is heat exhaustion or the heat stroke. This is a very interesting part because what we will do in periods of heat with our patients, if we want to make active exercises, the patients, for example, elderly patients, come into the practice and they are physically not able to make some exercises because it's too hot for them. And it's very important that physiotherapists should know the symptoms and signs of a heat exhaustion and heat stroke, because Elena taught us this is a medical emergency, and with more heat, we will have more of these emergencies, and it's the same like, for example, a heart attack or a stroke. And this could be placed in a session about physiology, pathophysiology, or emergency medicine. Now I will give you an example how we address the topic planetary health education in studies in Germany. The environmental physiotherapy association founded the EPT agenda, or especially Filip Maric did it, the EPT agenda 2027, with the aim to implement planetary health aspects in all physiotherapy studies around the world. And in this context, Reform Health for Future Germany and the German Alliance of Climate Change and Health developed this workshop for schools and universities to empower the teachers to implement planetary health in their lessons. We have 3 formats of this workshop. For example, a 90-minute format for inspiration. This is good to implement this format in team sessions. We have a 180-minute format for developing first ideas, and we have the 180+ format. It's so a day workshop for developing specific content, for team development, and for curricular development. Here you can see a picture of one of these Teach the Teacher workshops in Dresden. Maybe somebody know Dresden. It's a relative important city, or well-known city in Germany. So actually, we started with this Teach the Teacher course in summer 2025. And 8 schools and universities in Germany, Switzerland, and Austria have already participated. And 4 additional workshops in schools are currently being planned. So we are on a good way to realize the EPT Agenda 2027. And I think Filip will tell us something more about the agenda. I added here some additional sources. Maybe you all can get my presentation after the webinar. And thank you very much. And yeah, I'm happy to hear some questions for the discussions after our speech.
Thank you. Thanks, Minettchen. Yeah, thanks to the European Region and World Physiotherapy for making this happen. I think super important topic, of course, for me personally, but I think also it's an increasingly important topic for us as physiotherapists, and it's important that our large sort of professional organizations put this topic on the map in the way that the European region has been doing for a while now. So it's really great. I'll talk a little bit sort of essentially, I'm kind of standing for the Environmental Physiotherapy Association here. I will also talk about the EPT agenda specifically. The two are quite closely related, but essentially I want to give you just a little bit of an overview of sort of how the EPT agenda came together and also where it's gone and sort of where it's been, and maybe with that we can also think a little bit about where it needs to be headed, or kind of where all this work that we're talking about here needs to be headed from now on. Okay, so basically, so we founded the Environmental Physiotherapy Association in mid-2019. It was Professor David Nichols from New Zealand and myself wrote an editorial at the time that we published at the time, and that we used the publication of as a means to see if there would be other people that would be interested in working on some of these topics. Right away, like at the time when we launched the Environmental Physiotherapy Association, it was also sort of like mid-2019. Climate strikes around the world were still a very kind of like active presence. At the moment, it's maybe kind of like not so much in sort of like the headline media, that kind of work, but they were still very impactful at the time. And maybe in some ways in association with that, one thing that also happened with the launch of the EPA was that a lot of students would join the Environmental Physio Association and express a very sort of like clear, passionate interest in exploring this, right? Next slide, please. Yeah. So one of the issues that we've had, however, as kind of at that starting point of the environmental physio, or one of the questions that essentially was the starting point of this association, was that we didn't have a really clear understanding of, well, what does physiotherapy have to do with the environment in the first place, right? Like that's not a thing that was discussed very much or very extensively or in a very sort of like thorough manner. So that was sort of like the starting point of this question. But then we also thought, okay, There's no way we're going to answer this question very quickly because the answer is likely to be sort of like quite complex and actually sort of like far-reaching and diverse in many ways. And so with the next slide, what we thought to do next is to actually follow the call of some of our students that were joining the EPA and that were asking, okay, so why are we not learning about this stuff in our programs? You know, why am I not learning about this in my bachelor's degree, in my, you know, pre-reg master's degree, things like that. And so we thought, okay, so the students are very clearly, at least the students joining the EPA are very clearly interested in having this in their programs. And we thought it makes all the sense in the world for us to try and get this into education as quickly as possible, because that's also the way we can most quickly affect practice or also most quickly affect it in such a way that it has a lasting impact in clinical practice of physiotherapy. So we set ourselves this very sort of like, nope, that was a bit too quick, Aitor. Just back one more. This humble goal of wanting to ensure that every student beginning entry or in entry-level physiotherapy education will have some kind of education about the relationship between health, environment, and physiotherapy as part of their program, or as part of their journey. Big ambition, of course, because there are many schools around the world, and you know, physiotherapy is being taught in many countries, but that's where we set out from. Next slide. So one thing we wanted to recognize right from the start, and I feel that this recognition is as important today as it was when we started, was that we were and still are very aware that curricula in physiotherapy are already like crowded. There's constant kind of discussion of, you know, us not being able to take things out. There's just like more things keep coming in. Now it's AI, and then it's this and that and so forth, and everything has to find a place. And so how do you deal with this issue, that the fact that curricula are always so full? We also wanted to recognize that there are very sort of like different legal frameworks and regulations in different countries that that are going to require that what we do in different places around the world in order to achieve this might be very different. And that also, as Robert mentioned, we had, and I would say in our profession still have a relative shortage of sort of expertise and content related to what is this kind of actually about. And we also, and this is also very important still today, kind of wanted to take a little bit of a, I will say, sort of slightly decolonial approach, as I suggest there, which is that we wanted to minimize sort of a kind of this notion of coming in with, here's the framework of what you need to teach, and you have to do it exactly this way. But we really wanted to foster and kind of the growth of a certain diversity and a certain sort of like approach to using education as a means to explore, well, what does physiotherapy have to do with the environment, right? So next slide, our two key strategies in the EPT agenda from the start in 2020 until today have been kind of the one key thing has been just to build a lively network of physiotherapy educators and students really that would develop all of this together. And the other would be that we build an open access database of all kinds of resources that can be helpful for environmental physiotherapy education. And so next slide. What I can say about our success as far as the network is concerned, and this is a little bit a kind of combining EPT agenda with the EPA, is that the EPA now has over 1,500 members from many places in the world. We haven't painted the entire world green yet. I would love to see that sometime in the future, but you know, we're on a good way, I would say. The EPT agenda specifically currently has a little over 110 participating institutions. So those participating institutions are universities, and I see many people here in the crowd that are also from those institutions that have said that, yep, we're committing to making an effort in this and finding a way for something to come into our program, even though we don't know how yet, right? Well, that was kind of like the starting point for many. And then we also have, for the EPT agenda, 40 plus supporting organizations, that different physio and non-physio organizations from around the world that just essentially express their support that this is very important, and you know, they're willing to help and you know, provide their own resources and things like that. And we've had great collaborations there as well. So that's how well our strategy has worked. Then the other kind of like key strategy was to develop a kind of resource base I would argue that at the moment, this is essentially the entire website of the Environmental Physiotherapy Association. And for those that don't have the link, I've just chucked it in the chat there. On that website, I think you can kind of like keep yourself busy for several months now, just reading material from the website, from the 150 blog posts in, you know, X number of languages to more than 80 peer-reviewed articles and counting all of these numbers. We have these inspirational case reports that were directly sort of like developed out of the EPT agenda that give people an insight into how this, you know, how people in different institutions, different contexts are trying to get this into their programs. We've run, you know, so many seminars, webinars, developed MOOCs and other types of sort of like course material. There's also, other than articles, there's book chapters, editorials, you name it, all kinds of other publications. And we've also been working on these teaching prompts for a while that are essentially something like this 2 slides for future approach that Robert presented. Also with a slight adaptation ultimately. And, you know, and then there's more material. I'm just not able to list everything here now. So we have developed a lot already. And as far as the themes are concerned that have come out, I'm not going to be adding a terrible sort of amount of new stuff here. A lot of it has already been covered by Elena and Robert already. But if we just go to the next slide, one of the key things that essentially, yeah, no, I won't go from there. I'll do it this way. So one thing that, for example, Robert and I have argued is that actually it's very easy and possible to include planetary health, sustainability, environmental physio education in all of the work that we do in anatomy, functional anatomy, physiology education in physiotherapy, which is still really fundamental to how we teach most of our courses and how we even structure most of our physio programs. So even from that start, actually, there's very sort of like clear links and starting points that we can take there. Building on this, on the next slide, it's very much sort of the same thought that it's also very clear that actually all movement is environmental, and if movement is one thing, if not the thing that physiotherapy is oftentimes interested in, then recognizing that all movement happens in some kind of environment means that we should take that environment into account a little bit more in the ways we think about, assess, treat, etc. Movements. One way, next slide then, that this is being dealt with and that's or looked at, and this is kind of like becoming quite big. Elena has also touched on this, is this nature-based health and therapy, you know, different kinds of approaches that integrate natural environments with therapeutic thinking and practice. There's a lot happening in this space that a lot of people are interested in. Next slide. Something that Robert has also mentioned is very clearly, you know, this ICF link, that actually if we use the ICF link in physiotherapy education, which I think a lot of people do, then there's a really sort of like simple extension by paying a little bit more attention to those environmental factors. And so seeing beyond maybe that pure sort of body structure function and maybe activity and participation aspect as a means to teach more about planetary health, sustainability, environmental physio in the kinds of things that we're already teaching anyway. Next slide, please. Also something touched on by Elena already, you know, this whole kind of notion about the environmental footprint of healthcare, you know, how big is that footprint in physiotherapy and how do we maybe contribute to its reduction? There's a lot of work going on in that kind of space. Next slide. And equally also touched on by Elena here is this whole kind of topic around active transport that also is, I think, really interesting for physiotherapists from the perspective of gradually sort of like moving our work and our thinking upstream into health promotion and public health kind of spaces, where what we need to work on are actually some of more the social determinants, structural determinants of health. And so while physical activity is in focus in active transport, it actually ends up being a lot about urban planning and other such things very quickly as a topic. And a little further along those lines, also kind of like thinking at those kind of like macro level, what can we do that we teach a little bit more about planetary health advocacy as one such way to get future physiotherapists to know how to get more involved at promoting health in a bigger scale. In the process of what we're doing in the EPT agenda and this kind of like process of finding out, okay, what can I do in this course? What can I do in that? And so forth. What we're actually doing is, and this is kind of my argument, is what we're actually doing is we're developing the competency or that kind of key competency or learning outcome or learning objective, depends on your language there, that we also want our students to develop, which is to understand the relationship between health, environment, and society in a way that is specifically related to physiotherapy. So we're kind of, as educators, as we develop this, working on the very thing that we also want our students to increasingly develop. And so just to deep dive into this understanding a little bit more, next slide. What I will argue we are finding out is that there is no physiotherapy that is not environmental. There's only a physiotherapy that hasn't made that explicit yet, right? And so this is really also coming through in, I think, what Elena presented and parts of Robert presented, that there's actually no subject, no topic, no aspect of physiotherapy that's not related to the environment in one way or another. So if that's the case, what we maybe don't need to do is to worry too much about creating standalone courses and so forth, like Robert has also argued, despite the fact that there's also value in having standalone teaching about these topics. But that a bigger part of what we're working on and doing is how to make explicit how environmental physiotherapy is integrated into everything we do already, and how it's actually embedded, and how can it be better embedded and made more explicit. The thing that I would argue additionally is that if we say, oh, it's in everything we do and we can just embed it, it might sound like that doesn't mean much, but actually, if we think this through properly, I think we will see more and more how integrating planetary health, environmental physiotherapy, sustainability more explicitly into what we think and what we do, that we will see that this will actually also drive really fundamental transformations of our profession in the future. So I'm going to close on this now, just sort of, first of all, yeah, of course, with a thank you. But I think what I want to say is we've been working on these topics now for a few years. It's 2026, 2019, so 7-ish years. A lot has happened, a lot has been done, but very, very clearly, there's a lot more to do. We still need more engagement. We still need more sort of diversity of thinking around all this, more applications, as much as has been done. And as much as certain patterns are emerging about what does this field entail, those patterns also speak to what we're not seeing yet. And so we need to also kind of like keep discovering and keep working on it if we want to do this in a really good way. So if we want to integrate planetary health, environmental physio and sustainability into physio education, but also ultimately practice and research and our profession as a whole. Thank you.
I think we'll cover the first one, which is around the webinar recording and the slides. There is so much rich information in the slides. So you will be sent the webinar recording and the slides after the webinar, so you can take a further look in your own time. So there's a few questions around that. But I'll open with the first question, which is about the increasing trend on increasing the number of physiotherapy courses and subjects in physiotherapy. And given that a curriculum has a specific duration and credit hours, how do you think we can convince physiotherapy departments to prioritise environmental physiotherapy over other subjects? So I think, Filip, you were talking to this a little bit around actually taking an embedding approach rather than a standalone, but is there anything more that you want to say around how you convince the
Yeah, I mean, I think Robert and Elena would certainly also be able to add to this, but I think from my perspective, yes, that's basically what I've argued is like, let's not worry about how to add a certain thing into a program, but identify how it's actually there anyway in all sorts of things, and sort of like enhance in these like a little more sort of like smaller ways but kind of everywhere, really. And if we do that, I think the challenge is much smaller. The other thing, though, that I want to add here is that the work of trying to convince someone to prioritize this, this is going to sound very harsh now, but I feel like I would feel insane if I had to do that, because how could they not? Because of everything that Robert and Elena have presented about what kind of challenge this is and what climate change means and biodiversity means for the health of people around the world, like biodiversity loss, ocean acidification, you name it, all of these kind of problems. How could we not do that? And how could we sort of like close our view and perspective and say, oh, no, not in the physiotherapy program. That's not so, that's not what we do, right? I think there's a really big problem there. So I wouldn't want to try and convince anyone of prioritizing it, in a certain sense.
And Robert, your slides, the slides that you shared, and I guess that's two slides for future, it speaks to that. Embedding little and often.
And I think it's the planetary health aspect is not an add-on like a new physiotherapeutic technique or something like this. It is involved in every kind of education we do. So, for example, if we talk about stroke or COPD, about the causes of COPD or stroke, then we have to talk about fine dust, because fine dust is a really important cause for stroke and COPD. And so we can talk where comes the fine dust from and how to reduce the fine dust. So, these are 2 slides or 1 slide in a lesson, and that's it. I think that's really easy, and this is my experience too with my colleagues, to make the first steps and then to develop the theme in the whole curriculum, like Elena taught us. Then the point will come to make a new curriculum. So, but first start with it in small steps.
Exactly. Thank you, Robert. I'll move on to another question for you, Elena. What competencies do physiotherapy educators need to effectively teach sustainable healthcare practices?
What competences do they need? I think their own interest. And then there is so much material you can find, and you just can start. The internet is full of materials. And I suppose even in your own language. What helped me was also there was the English information, which I got from EPA. But I also had a German website, which Robert is part of, the Deutsche Allianz für Klimawandel und Gesundheit. And there I could find a lot of material in our own language. And I think maybe this helps a little bit to get it in your own language. And that's even what we've seen or what we've heard from Filip. There are blogs in different languages.
So what you're sharing is a willingness to, showing that interest and that willingness, but also accessing the resources that are available that you can translate into your nation's language. Robert, is there anything you want to add from the Teach the Teacher, Teach the Teacher workshop? Are there any specific kind of competencies that you cover there?
I think there are not special competencies necessary, only the competencies of a teacher to read some new stuff, so to implement new evidence. So because what we're talking about is evident. We have a problem with heat, we have a problem with fine dust, and so on. And so we cannot teach what we teach 20 years ago. The world is changing and the evidence is changing. And this is a basic competence of an educator in generally. So,
evidence-informed teaching. Thank you. Another question from Sonia about what are the main barriers that you face introducing environmental physiotherapy from the students or the teachers? I don't know who wants to take that, but as somebody who used to work in a university, students want to learn anatomy, physiology, they want to get manual. So how do you have you faced any barriers with students or with teachers?
So the students bring me to this topic. They ask me, Mr. Richter, this is relevant. Why we don't hear something about it? They asked me in 2019, yeah, and then I developed myself to implement it in my teaching. So it came from the students, and now I have a lot of young people, and they are affected by environmental changes. They have a long future in her life with the effects of climate change. I don't see barriers on the side of students. Maybe it is in other institutions another point, but I can't see this. The most barriers are on the side of the teachers. Oh, I can't do that. I don't know nothing about it. And so take the 2 slides for future and do it. Yeah. So
thank you.
Yeah, I
Minettchen,
can just
yeah.
follow up on this briefly because I have the other experience also quite regularly, you know, that there's mixed reception among students, let's say, just as much there's mixed reception among teachers. I think my short summary for what is the main barrier is that people feel that somehow this is not physiotherapy or this is not related to physiotherapy, right?
Yeah.
That's kind of like that kind of like the first thing that often like, but what, you know, what does this have to do with me? What does it have to do with us and so forth? And so I think that this work that Elena and Robert and I have been presenting on making these sort of like small contact points, you know, these small interventions in different subjects is the work that is required in order to help people to see how this indeed has to do everything with physiotherapy and with every part of physiotherapy. So the barrier is also kind of like is the thing that gives indication of what needs to be done in a way. You know, people need to feel that there is this relationship to who we are, to what we do, you know, these kind of professional identity aspects, which then also requires a little bit, now if you tease it out, that actually there is a little bit of the more we learn about this, the more we have to understand, oh, I have to change my understanding of our professional identity a little bit. And that's classically not very easy for people. Not certainly not in physiotherapy.
Thank you. Thank you very much. I think that's all we can do as far as questions, but I just wondered, there are some more questions in the chat that we haven't answered, and I wondered if we could provide some responses to that outside of this meeting and share that with the recording and the slides. Is that okay for panel members?
Yeah.
To do that?
Yeah.
Okay.
Yes.
Thank you. Thank you. Well, you've all made a very strong case for change. So why would, we've got no choice. We have to embrace this agenda and move forward. Thank you so much. I'll hand back to Minettchen.
Yeah, thank you so much for the interesting discussion and for the questions we have in the chat. So in 2 minutes we are at the end. And so I want to say some words to the speakers. Thank you very much for your important contributions in the inspiring insights sharing during today's webinar on planetary health and sustainability in physiotherapy education through your diverse perspective and particular approaches. It became clear how important sustainable thinking and action are for the future of physiotherapy and the healthcare profession as a whole. Your presentation not only provided important impulses, but also encouraged important professional exchange and further reflection. So we would like to sincerely thank all members for their great interest and the engaging discussion. And a special thank you goes to Arthur, Secretary of the European region, and for all his work in the background, and as well as to you, Rina. So thank you so much for everybody for this webinar, and I hope you get some new ideas for your teaching at the university. So have a great evening. Bye-bye.